At this juncture, I want to invite the next presenter, who is also going to be talking to us, this time around bringing it home. He's taking it down to our doorstep. You can see, we started from the broad-based discussion, went to the general health segment discussion as handled by our dear Mr. John Iwajoko. We are now coming to the last part of this sub-theme, which is the critical role of community pharmacists in achieving universal health coverage. This is now bringing it down to our doorsteps. I want to beg you, open your eyes and open your ears and open your hearts, so that you are going to hear what is going to be proceeding from the mouth of our erudite speaker. The man that when he speaks, even the words listen. Please, put your hands together as you welcome our dear Professor Lere Baale to give us the second lecture on the critical role of community pharmacists in achieving universal health coverage. Needless to say that Professor Lere Baale does. Introducing Professor Lere Baale to a pharmacist is certainly going to mean asking the pharmacist to check whether he actually went to pharmacy school or not. So please, thank you so much, sir.
Professor Lere Baale, CEL, Business School, Netherlands International, Nigeria. Chairman, Board of Trustees, Association of Industrial Pharmacists of Nigeria, NAIP. President and Chairman of the Council of the Nigeria Academy of Pharmacy, and the Pro-Chancellor and Chairman of the Governing Council of Ojaja University. A student of grace, Kingdom Ambassador, servant leader and systems thinker. Professor Lere Baale combines humility with intellectual depth and values-driven leadership with experience across pharmaceuticals, consulting, telecoms, and education. He brings a powerful blend of corporate insights and academic excellence. He is deeply committed to unlocking Africa's potential by developing agile, ethical leaders who drive transformation, growth, and lasting impact.
My lecture will center around, instead of presenting the entire slide, I will just focus on one area that I believe is important. This gives a summary of everything I'll be sharing with you. And let me key into the existing protocol. I hope it can be seen. I can see it on my screen well. So I'll be talking around the critical role of community pharmacists in achieving, because I'm a product of Ahmadu Bello University. I need to mention that upfront. It is the, yes, I need to. Yeah. The expectation of an average graduate from ABU is far higher than what we met when we left school. I'm a product of Ubiaga. An internee Pharmaceutical University measures, calculates. I say an internee, I'm not talking of senior pharmacist alone. An internee measures, and because we make a compilation of medication error over a period of time. Every time there's clinical meeting, a pharmacist stands up to speak about the medication error. So a physician, the most senior physician, maybe a specialist like an oncologist or things like that, will be shivering because we are discussing medication error that has occurred maybe in the last 1 week, in the last 1 month, in the last 1 quarter. And so, with evidence. So, an average pharmacist is respected in Ahmadu Bello University Teaching Hospital. And I'm saying this so that you can understand why I speak from position of passion. Every physician will respect a pharmacist when you do your work. When a pharmacist compiles medication error, it's very natural. A physician who is not sure of what he wants to prescribe tomorrow will call the pharmacist first. So what do we need to do in this situation? The public assumes that the pharmacist is there to follow the instruction of the doctor. No. The pharmacist's role was not carved out for the purpose of following. It is for purpose of a second opinion, to confirm that the prescription is correct, to confirm that there is no medication error, to confirm that based on the existing disease condition of the patient, that the doctor have written the right thing. That's the reason why I became a pharmacist. It's not for the purpose of dispensing. It's for the purpose of guaranteeing medication safety for the patient. For you to understand the magnitude of the problem, worldwide medication error is estimated to cost $42 billion. Over 260 million people medication error in places like US. So let's say Nigeria has the same quality of healthcare, and we are 250. It means about 2/3 of 267 million is the number of medication error that exists in Nigeria. And because we do not have that quality of healthcare that they have in US, we should also be thinking something close to 300 million really. And every day a patient dies in US as a result of medication error. So what we can do, either we are in the hospital or in community practice, is to ensure that we are always doing what? We are making compilation of medication error. And we are providing an avenue to ensure that physicians around our community are properly educated. Once we start to do that, we'll be respected not just by the patient, we'll also be respected by the physician. So, my focus today is on why it matters. Nigeria has one of the highest out-of-pocket health expenditure. The preceding person has already spoken about it. The insurance improves financing, does not improve only financing, it also improves access, quality, safety, availability, affordability. The community pharmacies are among the most accessible, the most trusted, the most available healthcare professionals. It's easier to see a pharmacy than to see a physician who runs a clinic. For that reason, we have an advantage. The universal health coverage is not only about access and cost, it must include quality and patient safety. So who is the community pharmacist? He's an health educator, he's a primary health care provider, he's a digital health facilitator, he's a medication safety expert, he's a partner in integrated healthcare delivery, he is a coach when it comes to chronic disease management, is able to participate in facilitation and prevention of healthcare, is a public health advocate, is a medication therapy manager. So why is medication safety so important? And why is community and hospital pharmacies so important? WHO says the unsafe medication practices and errors cost the world about $42 billion annually. 1 in every 30 patients experience medication-related harm. Nearly half of all preventable harm in healthcare is medication-related. That is something that pharmacists can prevent. Up to 1 in every 10 hospital admissions in the developed countries are medication-related. Data, learning, and system improvements save lives and resources. So, We all know that when you have data, if you do not gather data, it means it has not been done. If you document, it means something is going to happen. If you can just gather data at the community pharmacy level and at hospital pharmacy level, the way BU Teaching Hospital does, the respect for pharmacists will not double. It will not quadruple. It will be 10 times. Because no physician will want you to identify that he has made a medication error. So, that's an area that I believe nobody is competing with us. That's an area that we just put pharmacists highly respected. In Ahmadu Bello University Teaching Hospital, an internee can walk into the ward. It's not a negotiable thing. You can walk into the ward, look at the files, identify medication error, and correct the physician. You come down to the south and I realize that you cannot even move near, you cannot move near the patients in the wards. If we start to make compilation from the outpatient pharmacy of medication error and we share it, physician will invite you voluntarily to come and help them check those in the wards. There are 5 strategic contributions to universal health coverage that I believe the average pharmacist can make. Number 1 is to improve access. I was asking in the leave before I say, how many functional primary health care centers do we have nationwide? By my last follow-up, we had 6,000 functional. There are about 30,000 on paper, theoretically. We had 6,000 primary health care centers. The last speaker spoke about cooperation, private-public partnership. Am I correct, sir? There's no better. I just wish that one day a pharmacist should come up as Minister of Health again. And he just spend one day and make a pronouncement. From today that I'm being sworn in as a minister, I declare private-public partnership on primary health care. I am therefore doubling the total number of primary health care centers nationwide with private partnership by adding the 6,000 from community pharmacies to the 6,000 that is being run by government. Finish, and we'll have 12,000 overnight. Unfortunately, our ministers are not educated enough to understand that if there is private-public partnership, community pharmacies provide superb service that is superior to some of the primary healthcare centers that are being run. Until they are given that formal recognition, so it will improve geographical distance they need to cover, time, financial barriers. It supports appropriate triage and referral. Because basically the community pharmacist will act as a primary health care center. You'll be a primary health care provider. It can always refer to a general hospital or to a tertiary hospital if necessary. So pharmacist enhances access, enhances availability, enhances affordability by buying in bulk and by ensuring that it's key to the logistic pyramid. It's also important to know, as I move to the number 2 reason why community pharmacies are so important. We know that healthcare delivery itself will not be credible without medicine. That's why Abacha and the rest of them who used to announce school, they will normally say that the teaching hospitals are like what? Consulting clinics. Because medicine is the major thing that makes healthcare delivery credible. So pharmacists are the most opportune human being on earth. They are the only course in the world where 60% is the pass mark. The only course in the world you can score less than 0. In dispensing, it's called minus 60. Because you did not identify medication error, they ask you to prepare 5% powder, you mistakenly use decimal point to miscalculate, and you did a 50%. They say you have killed the patient. Is there any course in the world you score less than 0? None. You are the most opportune people in the world. And you cannot afford not to demonstrate who you are. God has lifted you up even with the standard of a pass mark. I did my course with chemical engineers. I did my course with biochemistry. I did my course with medical students. And my pass mark was 60. I can't suffer that much and come out and I'll be treated as if I'm second hand. No. The one major tool you have in your hand is to have a record of medication error and bring together all the physicians in your community once in a quarter and share. You don't need to mention Dr. Usifo was the one who wrote the medication, who wrote wrongly. No. Just say, during the last 1 quarter, I got these prescriptions. This is a medication error. These are the things you should not be doing. Tomorrow, when they want to write something in that area, they will call you. I say, what should I do? I have a patient in front of me. You'll be respected. That's the way it is. The second thing is improving affordability, like I mentioned. You promote rational medicine use. Because at times there's polypharmacy. Too much medicines are given to patients that they don't really need. So, generic substitution, optimization, and early intervention prevents complications and avoids unnecessary cost. Number 3 reason, the 5 strategic contribution to universal health coverage is improving quality and safety. We detect interactions, wrong doses, contraindications, duplications. We prevent medication error, adverse drug reactions. We improve outcomes and reduce harm. When pharmacists learn to measure medication error, they generate knowledge. When they analyze that data or that knowledge, they improve practice. When they share that learning with the prescribers, they transform healthcare. And when they prevent medication error, they save lives. That is the highest calling of the pharmacy profession and one of the greatest contributions pharmacists can make to the healthcare of any nation. Ladies and gentlemen, I cannot overemphasize the need to improve quality and safety. That's the reason why we are pharmacists. We are pharmacists. You can use any of the pharmacy technicians to dispense. But your job, our primary job, is in medication safety. That's why we have an edge over any other person. And we must go back to it. Number 4, we need to strengthen prevention. Health promotion, screening, vaccination, blood pressure, diabetes, checks, lifestyle counseling, and chronic disease management prevent disease and save lives. And as we play a key role in strengthening prevention, which is better than curative medicine, we'll be adding more value. And we can do a lot of counseling at community level. We are usually the first point of call. Empiric study in Lagos has confirmed it. The Commissioner for Health has announced it. People go first to pharmacy before they start to go to clinics. So we can as well prevent a lot of disease condition. Or where they already have the disease condition, we can help them in managing the diseases. Number 5 is supporting health insurance sustainability. And I'm sure the insurance people will be happy for this. A lot of times people go to clinics and they get medication. I hear the case of an asthma patient who was told on how to use his inhaler. And she went back and said, this thing has not improved anyway. And the doctor said, can you please tell me how you're actually using it? She actually uses it like a spray, like a perfume. Now, if such a patient goes to a pharmacy and it has to be cancelled, it will improve adherence. Go back to community pharmacy or hospital pharmacy and go and do this survey. If you ask any patient to use any medicine 3 times daily, they think they use it with their meal in the morning, the meal in the afternoon, and their meal in the evening, which is wrong. It is 8 hourly. And for those of us who have spent our lives selling single daily dose medicines in Pfizer, the major reason why Pfizer was producing single daily dose medicine in chronic therapy was because adherence was seen to be a major factor in patients not getting well. It reduces emergency visits. It reduces admissions. It ensures better value for insurers and the health system, because insurers certainly want you to get well. And so if we use the drug in the wrong way, you're not going to get well. It's going to cost the insurance more money. What must Nigeria do? What Nigeria must do? Number one, we need to integrate community pharmacies into universal health coverage and health insurance architecture. We need to let everybody know who is in the healthcare space that the community pharmacists are actually the private PPP for health service. And until they are given adequate respect and treated as such, you will not be making the best use of the opportunity that Nigeria already has in pharmacy. Number two, we need to establish fair reimbursement for professional pharmacy services. Fair reimbursement for professional pharmacy services. We are not just selling drugs. We are also cancelling. We are also preventing some diseases from advancing. So when you say, when we measure your BP and we recognize that you have high blood pressure, you don't just go straight to medication. There are other non-drug therapies and ways to prevent. So pharmacists will need to be reimbursed for the professional service they render, apart from the concept of dispensing. Number three, we need to digitalize, and run digital transformation. There are 3 different things I've just mentioned. Digitize is to convert your paperwork into electronic form. Digitalize is to aggregate all your electronic paper to create a new information. Digital transformation is to change the totality of what you do and automate it. And so it's important for pharmacists to start to connect pharmacy practice and patient records. In one of the earliest time I had an opportunity to in his life. In the olden days, it was electronic medical record. It was built for medical purpose. Today, it's electronic. That's why I have 1 page. So we need to do digital transformation. It is electronic health record that is correct. If I'm in an hospital and they are talking about electronic medical record, know that you have not been taken into consideration. It is electronic health record that contains modules on pharmacy, on laboratory, and the rest of them. Electronic medical record is merely medical. We are not medical. We are pharmaceutical. We are healthcare practitioners. We are not medical practitioners. Take this into consideration. Number 4, we need to expand scope of practice responsibly with clear standards and training. We need to teach ourselves, pharmacists, how to keep records. We don't have to have computer, Excel, but just merely recording it. Today, I got 3 medication error in what area? Overdose, drug-drug interaction, polypharmacy, and summarize it and share it among the clinics around your community. You'll have done well. When you're able to use computer better, you put it on Excel and send it to them on WhatsApp. Next, it is time. When I spoke about loss of 42 billion in a year in worldwide, and I spoke about the fact that a patient dies every day in America due to medication error, then you imagine that the number of patients will die in Nigeria due to medication error will not be less than 2. every single day. And every life is important. It is time for pharmacists to, no problem, to clearly state, build a national medication safety reporting and learning system. And we need to have a unit that deals with medication error. Pharmacists, once you win that war, and there's a directorate directly in charge of medication error, it starts to raise pharmacy practice to a new level. Number next, invest in future-ready pharmacy workforce, and let us emphasize their role. So if they find themselves in the hospital or in community pharmacy practice, they will be able to see the value. We need to strengthen interprofessional collaboration. We shouldn't use medication error data to intimidate doctor. No. It's to use it to help them, to show them the right kind of medication and the type of medication that cannot be used together, so that we can have integrated and patient-centered healthcare. Ladies and gentlemen, before I close, I've developed a safety and learning framework whereby you capture errors and near misses, you report it. You analyze and identify the root causes and contributing factors. You discuss in multidisciplinary meetings either at the community pharmacy level or at the hospital level, so that everybody can learn. Then you improve by implementing corrective actions and process improvement. You monitor measures and outcomes and track improvement. You share, you disseminate lessons learned across institutions. Ladies and gentlemen, our vision for Nigeria should be every city has a community pharmacist within its reach. Every community pharmacy is a primary healthcare gateway. Every patient receives safe, effective and affordable medicine. Every medication is optimized and every preventable hospitalization is reduced. And every likely death due to medication error is prevented. And we can use the data to increase the number of pharmacists that are produced in our country as well. Every insurance scheme recognizes the value of pharmaceutical care, and that every community pharmacy is a catalyst for healthier families and stronger communities. I will say with authority, ladies and gentlemen, that universal health coverage will not be achieved by one profession acting alone. Let us build together a healthcare system that is accessible, that is safe, equitable, efficient, and sustainable for every Nigeria. God bless you.
Well, this is a man who can deliver 5 lectures in a day, covering different areas of life. And I wonder what happens in this your brain. The amount, yes, I can understand about the innovation in his brain. That Prof can take any task at short notice and deliver. Thank you, my professor. Thank you, my mentor. One day when I grow up, I'll be like you and I can speak like you and write like you. Congratulations, Prof Lere Baale. Thank you.
Sun go shine, we no go tire. Night go come, they go break, we go see the dance, be your bar. Show up about that, but don't wait here. Talon Pangela, there's 40 here. No shade go the air, no shun no man. I did not master, I love man. God don't promise me, say, no story. Oluwa ti ṣe mi la oni yosi. From nothing to something. From primary to second. From the street to love, I go give God the glory. That's for me, I'm